Welcome everybody to Go Local Live. I'm Josh Fenton, CEO and co-founder. A couple quick notes. Governor Raimondo is just finishing up her press conference today. She announced, the state announced 26 new deaths, pushing the total up to 636 total deaths since the coronavirus hit Rhode Island roughly now about 12 weeks ago. March 1st was our first announced case. Also want to thank Zach Levesque from North Point, who joined us earlier today to talk about some of the issues hitting the mortgage and real estate market and also what's going on Wall Street. Wall Street is having a banner day, up last look over 600 points. Let's go to Dr. Michael Fine, former Director of Health. Dr. Fine, thanks so much.
Nice to be here, Josh. Good to see you as always.
Dr. Fine, we're seeing number of new cases on a daily basis begin to come down. Deaths are still a very significant issue. Last week in a 7-day period, it was our second highest number of deaths on a weekly cycle. And again, over the last 2 days, another 26 deaths in Rhode Island. Where are we right now?
In Rhode Island, as you reported the number of deaths, we have about 14,000 total people who have tested positive. Relatively few new people over the weekend tested positive, but it was the weekend. I think we had 73, 226 hospitals, 50 in ICUs. So the good news is we have hospital capacity if we need it. The bad news is I'm worried about whether we're going to need it or not, because as time passes from the loosening of restrictions, that's when we would look for an uptick in the number of infections. Toward the end of last week, we saw something that might have been a little uptick in Pawtucket and Central Falls, not borne out across the state, but I think that's what you're going to see. You're going to see the uptick most in the urban core and then later in the rural areas.
In Italy, over the past few days, they relaxed restrictions significantly. Rebecca Cotto da Silva was on Friday. She talked about those issues, Skyping in from Bolzano, Italy. Over the weekend, they saw really strong violations of the relaxed restrictions, people meeting in mass, people not wearing masks, people greeting each other with traditional kisses on each cheeks. And the government in Italy is now saying, hey, listen, we may have to go back to the harsh restrictions if folks aren't going to follow what the new standards are.
Josh, the problem is with the science. When we imposed restrictions, we used a broad brush and closed down lots of stuff. We don't quite know how much restriction we need to actually prevent the transmission of the disease. So it may be, because there's no real science behind this, that we may get away with less. It may be that we don't. And the problem is we don't know till the virus gets transmitted. And it's 3 to 5 or 6 generations of transmission. So we're talking about 15 to 30 days before we see those numbers begin to change. And by the time we begin to change, we've got a whole bunch more infections. So it's a rough titration. There's no science here, and we are feeling our way in the dark.
Let's go through the numbers. The United States is going to surpass today 100,000 deaths. That's functionally assured. 636 in Rhode Island. Take us around the world as we know it as of today.
Sure. In cases, 5.631 million cases, 2.4 million roughly recovered. Going up around the world, 50 to 100,000 every single day. And again, I have my eye on the developing world and the densely packed places, because I think that's going to be a heartbreak. U.S. cases, we are at 1.7 million cases, going up 3 to 5,000 a day. Rhode Island, we already talked about. U.S. deaths, as you said, about to cross 100,000 sometime, likely in the next few minutes if it hasn't happened. The trend in U.S. deaths has been lower over the last week. That's a good thing, but the trend in U.S. infections continues. And so I think we will see an uptick in the U.S. deaths as people, places like Montgomery, Alabama, and other small cities around the country start to get themselves in over their head.
Yeah, you saw it this weekend with news coverage from especially southern and western states of complete lack of attention to social distancing on beaches and pools and bars, on walkways in major tourist areas. That transfer of infections, let's say a transfer of an infection took place in a significant number on this past Saturday. That person's then going to go home who's been infected and infect other folks within their family unit. How long is it till we're going to see from that infection that took Saturday to the hospitalizations in some cases and the continued spread of the disease? How long is that time cycle?
So it's probably about 3 weeks. So 5 to 7 days of incubation period, then 5 to 7 days of worsening illness. And people tend to crash and burn with the illness 7 to 10 days out. So, 10 to 15 or 20 days, something like that. About 3 weeks is when you'll see people going into the hospital. And then the ICU numbers will probably climb 2 or 3 or 4 days after that. And, and the science isn't perfect. And the thing that in some ways I'm watching out for is whether that spike does not occur, because we could still be surprised. Just because we make predictions doesn't mean they're going to come true.
Yeah, listen, there's, as I mentioned to you before, Megan Ranney, physician at Warren Alpert Medical School and over at Lifespan, who's a frequent contributor CNN, posted a series of tweets this weekend about how little we know about the coronavirus. She and I exchanged through communications. We ran it, I think, on Sunday. It was a big read, but it really underscores how little information 6 months into this disease we really understand about it.
Yeah, no, I mean, what we don't know is way more than what we do know. And what we don't have control over is way more than what we have control over. That's why controlling this disease is proving to be so difficult. One, because it's easily transmitted, but also because we do not have any kind of reasonable test of people who are asymptomatic and have the virus. We don't know who they are. We have many false negatives in the tests of people who are symptomatic and might be positive. So there are lots of people who are symptomatic, have the virus, can spread the virus, and test negative anyway. And so they effectively slip through the cracks. And the turnaround time for contact tracing turns out to be an incredibly narrow window, really only about 3 days. And that makes contact tracing, kind of always playing catch up, as good as people are at that. And those things make me begin to question how effective we're really going to be at reining in this disease over time. We've done great so far, and absolutely great so far, but that has depended on social distancing. The question is whether we can keep control of this disease when social distancing begins to fracture or fray, as it's doing in Italy and did in the Lake of the Ozarks and on beaches around the country.
Yeah, I mean, Dr. Fine, what we're seeing and now as we go into phase 2 in Rhode Island of really bringing back a number of the restrictions, folks are going to be sitting in restaurants near each other. People are going to be getting their hair done and their nails done. People are going to be returning to gymnasiums. That's going to create, even with some folks using masks, and everyone certainly isn't, a lot of spread. And
it's going to create the potential for spread. remember, if you're in a place where there is no disease, if you're in a rural place where, if you're on Block Island, where apparently there is almost no disease, then there's no disease to spread, and there's
Right.
little risk. If you're in Central Falls or Pawtucket or Providence, where there's still plenty of disease, that activity is going to pass things around. And clearly, as you pointed out, people from Central Falls and Pawtucket and Providence find themselves hanging out with people from Block Island and East Greenwich, and that's where the transfer is going to happen. But I suspect that transfer from the disease endemic areas to the disease where the areas where disease is less, I think that's going to take longer than our 3 weeks. And so, look 6 weeks down the line for it to start popping up in places where it hasn't been yet, if in fact the degree of social distancing that we are at now is inadequate.
So in following your timeline, if we're opening up and people begin to come back in certain parts of the country that have opened up previous to us, the consumer has not come rushing back into restaurants. They have not all come rushing back to get their hair done. But we're talking about if June 1 is the relaxation of a lot of the social distancing restrictions, we're looking at somewhere around early August to mid-August to see what the implications of that is.
Yeah, maybe the middle of July to early August, if the social distancing that we have left isn't adequate. And what we don't yet know is how much social distancing matters in terms of number of new cases of disease. Clearly it matters and was incredibly effective at stopping progress initially, but we just don't know whether sitting in a restaurant actually makes a difference. Certainly there were reported cases in China where it made a huge difference, and there's documented transmission, in the restaurant that was reported with the air conditioning system it had and the table arrangement it had. But
Right.
will our new table arrangement, in fact prove to be adequate? Time will tell.
Dr. Fine, you get the last word, sir.
Well, again, I'm thinking hard about the extent to which this is containable. And again, my focus continues to be on preventing preventable deaths, which means people at risk ought to think very carefully about loosening their restrictions. And we ought to be paying particular attention to people who don't have good access to care. So if they get sick, we can get them the hospital care they need as soon as they need it. So far, we're doing great. Let's keep our fingers crossed and doing everything we can to protect the people at greatest risk.
Dr. Michael Fine, as always, thank you, sir. For everyone else, stay tuned to some updates on GoLocal, and also, please stay safe. Thank you.